Good morning, good evening, good night, doctors, nurses, and pharmacists. I'm DrChe, and today we will give feedback on your letters. If you can hear me, just let me know, please. If you can hear me, okay, let me know, please. Okay, and we should start. Okay. Okay, just let me share the session with other doctors, nurses, and pharmacists. If you can share the session with other doctors and in other groups, that would be great. Okay, so then we will start. Okay. Okay. So just give me 1 to 2 minutes to share the session and then we can start. Okay. Okay. If you can hear me, just let me know. Okay. Just let me open my letter, then we will start. Okay. Okay. Just let us start. So today we will discuss your own letters. Good evening, Miss Sidra, Shan Rathod. Very difficult names. I'm really sorry. Okay. So Okay, thank you. So let us start. Can you see my case notes here? So these are the case notes, Jink Walter case notes. Okay, these are my own case notes. And let us open the model answer. Okay, so here we have model answer. So first we will discuss letter of Miss Miss Bagia. Miss Bagia, are you there? Miss Bagia, are you there? And Dr. Nadeem, are you there? Miss Flora, Dr. Suzu, Miss Mina or Nina, whatever, Dr. Hinza, Dr. Digia, Mr. Royal Ayub, Dr. Laila, Miss Okoro Jenny. So any of you is there in the class? So let us start the discussion of your letters. No? Okay. So Dr. Suzu, okay. Maybe Shristha, so I don't know what we should call you. Dr. Hinza is there, Royal Ayub is there. Okay. Okay, in my WhatsApp, but now it will be very difficult for me to mark these 10 letters. Okay. Okay, so Bagia, Miss Bagia. So let us first mark this one. Miss Bagia, okay. So first of all, before we start marking this letter, what we need to do is we need to count the words, okay. This letter has 197 words. That is good. Greeting, and the last part is missing, maybe because she is in hurry. Now let us start reading the purpose. I am writing to inform you. I am writing to inform you. This is not good. Inform you, Mr. Jing Walter. This is a discharge letter. I am writing to update you on. I am writing to update you on. Miss Walter is enough, not enough Jing. A 60-year-old patient. Instead of patient, we should write, a woman. Okay, like this. So what is missing here? Something is missing here in this part. Can anybody point out? Can anybody point out something is missing here? Who is missing here? Who is being discharged today? So, can anybody tell me what we write in the purpose? Two things that we write in the purpose. Two things that we write in the purpose. Two things. Number one, what is wrong with the patient? Number two, what we want from the reader to do for this patient. Can you tell me what is written here in this first sentence? Whether what is wrong with the patient, whether what we want from the reader to do for this patient. So both of these things are not mentioned here. So this purpose is not good. This purpose is not good. This sentence is not good. This is adding nothing. Just telling that she is being discharged, nothing else. So this is very simple and not good sentence, okay? She was admitted to the emergency department for the management of second degree burns plus. This plus we cannot use when we are writing letters. This is language of case notes. Okay. So plus no and post-traumatic stress. Between post and traumatic, we should use hyphen. Between post and traumatic, we will use hyphen. Post-traumatic stress disorder following domestic violence. She requires your follow-up care. This is very simple sentence. Very simple sentence. Very simple. So we need a lot of improvement in this purpose. Maybe this purpose will get 1 out of 3. Okay. The purpose, we have 3 marks. So this purpose will get 1 out of 3. Okay. This is not good. 1 are very difficult to get 2. Okay. Now let me show you my model answer. I am writing to update you on Miss Walter. I am writing to update you on Miss Walter, who has been treated for second degree burns and post-traumatic stress disorder due to domestic violence. This is what is wrong with the patient. Your follow-up care would be highly appreciated. This is very, very good and excellent way to write the purpose for this letter. And this is my WhatsApp number. If you need any kind of help, you can contact me. Okay, so now let us move to next. On this date, Miss Walter's husband was poured a bottle of acid on her face. Okay, so can anybody point out any mistake in this sentence? On this date, Miss Walter's husband was poured a bottle of acid on her face. What is the mistake here? Can anybody point out? Can anybody point out what is the mistake here? So the mistake is has no. This is not today. This is in the past. Has we cannot use. So we don't need was, just poured. On this date, Mr. Walter's husband poured a bottle of acid on her face. Very simple sentence. This is not good. She presented to the emergency department. Actually, she didn't present. She was brought to the emergency department. Okay. We should write she was brought to the emergency department by ambulance with severe pain, redness, burning injuries on her face, just burning sensation on injuries on her face and head, back. Moreover, we should not use moreover in OET letters. Moreover, furthermore, these things we done. White and black blisters were seen on her right side of the face. Her BP was this and her other vital signs were unremarkable and she reported shortness of breath. Okay. She was prescribed morphine, ciprofloxacin should be small. These are the generic names. Actually, this should be part of the first sentence. You should organize the letter in such a way that initial visit, next visit, next visit. Okay, like this. Don't continue the same visit in here also. This is not good. Tetanus booster dose and silvazine dressing was applied. She was prescribed. Booster dose, we cannot say prescribed. This is not good. Silvazine was applied for burn ulcers. Burn ulcers, no, ulcer is not mentioned anywhere. She made significant progress for the treatment. Very simple sentence. This sentence is very simple. She was developed depression. What do you think about the sentence here? She was developed depression and social thoughts due to 1 to 2 centimeter multiple scarring on the right side of the face of her face. So she was developed. Can we use she was developed? She developed only. We don't need passive voice here. Furthermore, we cannot use in OET. She has. You can see that this student is writing here. This is part of first visit here. Then this is next visit. Then here is the social history, family history, then counseling, and all the things are mixed here in the one paragraph. So paragraphing is not good. Paragraphing is not good. She has a family history. We need article here, a family history of depression. Therefore, she was referred to. So, therefore, she has a family history of depression. Therefore, she was referred to clinical psychologist. This is not the reason. This is not the reason. Family history is not the reason to refer this patient to the psychologist. This is wrong here. In addition, she referred to plastic surgeon. So is there any mistake here? Any mistake here in the tense here? She referred to plastic surgeon. It is wrong here. She was referred to plastic surgeon. Okay, who was scheduled to. This is again wrong here. Who was scheduled to plastic surgery? This is wrong here. I would be grateful if you could monitor her suicidal thoughts twice a week and her compliance of no to. Her compliance to oral Mirtazapine should be small. This is generic name. Not a big mistake. 5 grams once daily. Okay. So what should be the score for this letter? What should be score for this letter? What should be the score for this letter? Yes, it is C grade and we need a lot of improvement. Okay. So maybe this student is a new student and just writing first, second letter. So no C plus, the Miss Uma no, C plus no, is C grade. D no, D no. Okay, is C grade, we need a lot of improvement. Okay, next is Dr. Nadeem. Dr. Nadeem is there? Dr. Nadeem? Dr. Nadeem is there? Dr. Nadeem? No? Dr. Nadeem? No? Okay, D no, is C plus. So now I will show you a good letter now. Dr. Shrista, Dr. Suzu, I don't know what should I say. How should I call you? Okay, so first of all, when we open the letter, first we will see the number of words. Okay, 195, that is good. Greeting is good. DrChe, general practitioner. Practitioner should be P capital. Greenfield Family Practice, OET expert, Manchester, expert street. Okay. Then one space here, very good. And here we don't need space. Then date of birth and these things. I am writing, so here I am, M cannot be single M. It should be AM, M, okay. I want to update you, update Mr. Miss Walter, no, update you on Miss Walter. I'm writing to update you on Miss Walter is missing, okay. A 60-year-old woman who has been treated for second-degree burns and post-traumatic stress disorder due to domestic violence. Your further follow-up care would be highly appreciated. Very good. Initially on this date, Miss Walter was brought to the emergency department after her husband poured a bottle of acid on her face. Very good. She complained of shortness of breath. It should be small, maybe typing mistake, severe pain, redness, and a burning sensation. We need here article. A burning sensation. In the affected area, in the no, on the affected area would look better instead of in. On examination, a blister of, this is not a single blister, please. This is wrong here. Single blister, no. Blisters of 1 to 2 centimeter on the right side of her face were noted. Okay, so please write plural. This is not a single blister. Therefore, acid was removed. Therefore, does not fit here. Therefore, does not fit. Just you are writing linking words just to put them there, just without any logic. Okay. In OET, we don't need to write a lot of linking words, just where it is natural use. The acid that is already mentioned, the acid was removed from her skin and clothes, and a silversine dressing was applied. Additionally, morphine solutions were given with a booster dose of tetanus. Very good, excellent, well organized. On this day, Miss Walter was depressed and had suicidal thoughts due to scarring on her face. Thus, she was referred to a plastic surgeon for her surgery, which is planned on this date. Very good. Together with is not good. Together with the clinical. No, this is not good. You should write separately about referral to a clinical psychologist for emotional support and counseling. So you should write a separate sentence. This is not good. Okay. Today, Mr. Walter's condition has improved. Following discharge, she was advised. Instead of I would prefer is advised. Is not wrong, but she is advised to visit her GP twice weekly to monitor suicidal thoughts. Can you note that her compliance with metrazapine needs to be monitored carefully? Actually, we should address this that the GP should do this, so we can little bit improve here. In view of the above, I would be grateful if you could kindly. Could is already a request. You no need of kindly here. Just remove kindly. If you could assess and manage her as you feel appropriate, very good. Okay, so what should be the score of this student? So please wait. I'm coming back in 2 to 3 minutes. I need to see a patient. So just tell me what should be the score of this student, and then I'm coming back. I will continue next letter. Okay, thank you so much. Okay, sorry, I got an emergency patient. So now let us do quickly Dr. Nadeem's letter. So Miss Dr. Shrista, Dr. Suzu, whatever your name is, your letter is very good. You will get B grade. Okay, you will get B grade. This is Dr. Nadeem's letter. I am writing to update you regarding Miss Walters. So first, let us count words. 238. So Dr. Nadeem, your word count is should be less than 220. Okay. So I'm writing to update you regarding is okay, Miss Walter, who has been suffering from PTSD due to a domestic violence. Who has been suffering? This is not something long term. This is not good start. Okay. This is not good start. Your further follow-up care between follow and up, we need hyphen. Would be highly appreciated. Initially on this day, Miss Walter was brought to the emergency department after her husband poured a bottle of acid on her face. She had severe pain, redness, and burning sensation, on the affected sites. On examination, she was hypotensive and 1 centimeter of white and black blisters were present. Instead of were present, were noted would look better on the right side of her face. Subsequently, the acid was removed from her skin and clothes, and a severe dressing was applied. She was commenced on morphine, ciprofloxacin, and booster dose of tetanus was also given. Very good. Excellent, Dr. Nadeem. But it's too long. You need to be a little bit concise here. 1 week later, Mr. Condition improved, but she still had mild pain and a tingling sensation. We need article here, tingling sensation on her face. On examination, we need comma here. She was depressed and had multiple scars of 1 to 2 centimeter on the right side of her face. She was referred to the hospital psychologist for counseling and emotional support. Very good. On this state, Miss Walter was very depressed with suicidal thoughts. She had no interest in the life due to scarring on her face. For which she was referred to a plastic surgeon and a surgery was planned on this state. This was discharged. Was discharged? No. We should write is being discharged. Is being discharged, and this is not needed. Today she is being discharged as she is feeling well. Her condition has improved. Please keep monitoring her for the suicidal thoughts at least twice a week, and also monitor her compliance with the medication. We should mention the medication, mirtazapine, that is for depression. Okay, Dr. Nadeem, I will give you borderline B. I will give you borderline B. The reason is your letter is long, 238 words, and we need to be a little bit more concise, and there are some points that we can improve. Okay. So overall, it would be borderline B. Please be a little bit more concise. Miss Florence is there, Miss Florence? Okay, Dr. Meena here quickly, because doctors sometimes write good letters, most of the times. So Dr. Meena here we need. Okay, Dr. Meena, are you there? Dr. Meena? No. So let us go for Miss Florence. Okay, Miss Florence, let us count your words. 243. 243 words. That is not good. We need to be concise, write less than 220 words, between 180 to 220. I'm writing to update you regarding Miss Walter. Aged 60, no, a 60-year-old woman, okay? Instead of age 60 is not good. Who was admitted to at Newton Hospital. No need to mention the hospital. And is better who has been treated for second-degree burns as a result of domestic violence. She is being discharged today and will need, though. This is not a polite language. What we should write instead of will need? What we should write polite language? Okay, Jenny, I will mark your letter. Thank you. Okay, would, okay, and would require your ongoing care. Okay, on this date, on the, we don't need article here with date. On this day, Miss Walter was admitted via no to emergency department via no. Presented, okay, emergency department presenting with burns on her face, neck, and head. Also redness, blister. Okay, right face and severe pain. Okay, what is the problem with this sentence? Can anybody tell me what is the problem with this sentence? What is problem with this sentence? Would require. We should write would require. What is problem with this sentence? Can anybody point out what is problem with this sentence? Actually, it's too long. It's too long. Is complicated, is too long, is difficult to understand. If you write a lot of information, if you write a lot of information in one sentence, if you write a lot of information in one sentence, it becomes difficult for the reader to understand. It becomes difficult for the reader to understand the situation. Okay. It becomes very difficult for the reader to understand the situation, then you will lose marks. Okay, this is not good. Okay, last time she had a redness. The redness, where is the redness? Okay, redness, white black blister on her face. She was treated with morphine, and the booster dose of tetanus vaccine was given. This is sentences. Okay, actually, water was used to. This is not good. Water was used to. Her the acid was removed from her skin by water, something like that. This is not good. And her wound was dressed with silverzine. Is okay. Silverzine should be capital. During hospitalization, a week later, no need of during hospitalization, just a week later is enough. This water's condition was improved, although she reported mild pain and some tingling sensation on her face. She was depressed due to multiple scars on her face. You can see this is again very long. As a result, she was referred to clinical center for the counseling and emotional support. 2 weeks later, please write a new sentence, new paragraph, because if we continue writing the same paragraph, it becomes difficult to understand. Okay. 2 weeks later, there was no improvement. She reported there was no improvement. It is not written there was no improvement, just she had suicidal thoughts. Okay, she was referred to a review and plastic surgeon and booked her surgery. And they booked her surgery on this date. This is wrong. And her surgery was booked on this date. Okay, we should write like this. Following her discharge, Mr. needs monitoring with her medication to see if she complying. This is wrong. If she complies with mirtazapine should be small, taken once daily orally. Most importantly, we need comma here. She will need to be she will need to review. She will need to review is grammatically wrong sentence twice weekly regarding her depression and continuity of care. Okay, so conclusion should be written a little bit more clearly. So what should be the score for this letter? What should be the score for this letter? What should be the score for this letter? What should be the score? Is almost is not very bad C, but it is close to C plus. I can say borderline C plus, like 280 to 90, like this. 290 is close to C plus, but not C plus. 290 to 80. No, no, C plus, no. Is C, but close to C plus. Okay. Okay, so Dr. Meena, Dr. Hinza, Dr. Degia, Royal Ayub, Dr. Lela, Miss Jenny. Okay, Miss Jenny is there. B no, Miss Jenny, B no. Okay, so this is Miss Jenny's letter. 175 word count is okay. I'm writing to update you on Miss Jing Walter. Miss Walter is enough, who was diagnosed with second degree burns. We don't need this capital. This should be small. Post-traumatic stress disorder should be small, no need of capital. Dr. Inza is there, okay. Dr. Miss or Dr. DK is also there, okay. Following domestic violence, she is feeling better and being discharged today to you for further care. Please make it right in typical style. She is being discharged today and would require your further care, follow-up care, whatever we can write, okay. Okay, Miss Jenny, this is your letter. Initially on this date, Miss Walter was brought to the emergency department. Department should be capital, not small, by the police after her husband had poured, no, this is wrong. After her husband poured acid on her face. We need active voice here, not passive voice. She had shortness of breath, severe pain, in no. N is wrong. She had shortness of breath, severe pain, redness, and a burning sensation. A burning sensation on her face. On examination, we need comma here after examination. White and black blisters. It should be plural blisters. Blisters were noticed. About white and black blisters of 1 to 2 centimeter were noticed on her face. This should be like this. Her wound was dressed with silvazine and supromazine. Morphine was commenced with ED, and morphine should be small, not capital. This is generic name. A week later, Miss Walter's condition improved, but she had mild pain and a tingling sensation on her face. On her face, days later, how many days later? So this is not good. Miss became depressed with suicidal thoughts, suicidal spelling mistake, maybe typing mistake, thoughts with S, due to scaring on her face. Her face. Okay, it should be new sentence here. She was counseled, giving no. She actually, we should write she was referred to a clinical psychologist for counseling and emotional support and plastic surgeon for cosmetic correction. This is not good. Cosmetic surgeon for cosmetic, plastic surgeon for cosmetic correction. So this is not good. Surgeon reviewed her and booked her for surgery on this date. She is to visit the psychologist. She is to visit is not good. This surgeon reviewed and booked her surgery. You should be here, not here. Okay. So Miss Jenny, overall you are doing well. Okay. Overall you are doing well, excellent. And if you improve a little bit more, you can easily get C plus. Okay. It's good ladder. You have tried to be very concise, very good. But there are many points that we need to improve. So I will keep it a C plus, sorry, C grade, but it can be improved. Okay, it is, you can easily improve a little bit more. Okay, so Dr. Hinza. So Dr. Hinza, your word count is 177. You should try to a little bit write more. 177 is less for this letter. I'm writing this letter to inform Dr. Hinza, this is your first letter. It looks that this is your first letter, Dr. Hinza. I'm writing this letter, no need of this letter. I'm writing to update you on Miss Walter would look better. We need here comma, imminent discharge back into your esteemed care. No, we write two things, Dr. Hinza, in the purpose. Number one, what is wrong with the patient? And number two, what we want from the reader. Dr. Nadeem, I think I have marked your letter. I think so. So don't worry, Dr. Hinza, this is your first letter. So in purpose, we write two things. Number one, what is wrong with the patient? Number two, what we want from the reader to do for this patient. I will share my model answer. I have 180 to 220 words, Miss Sidra. Okay. So number one, what is wrong with the patient? And number two, what we want from the reader for this patient. On this date, Miss Walter was brought to the emergency department, should be capital. By ambulance, there was history of There was history is not good. History of domestic abuse by her husband who poured acid on her face. She had severe pain, redness, a burning sensation along with 1 to 2 centimeter blisters. No need of scene noise is not needed on the right side of her face during Walter's stay in the hospital. Acid was removed from skin and silvazine should be capital. Dressing was applied on it. We should use pacifiers were commenced. Morphine and ciprofloxacin were commenced. Moreover, we don't use an OET. Test tubes were also given. After 1 week, Miss Walter had a good improvement, but still she had mild pain and a tingling sensation on her face. Very good. She was depressed. That is why she was referred spelling mistake. REFE double RED. She was REFE double RED, referred to clinical psychologist for counseling emotional support. On this time, Miss Water was quite depressed due to scarring on her face. She was referred to plastic surgeon to review for possibility the possibility of plastic surgery, and her surgery was planned on that. Don't repeat surgery and surgery again, please. Is being discharged into your care for further monitoring of thoughts twice weekly. And you can add this one in the same sentence. Please don't write two sentences here. So overall, Dr. Hinsa, you have tried very well, Dr. Hinsa. But we can use but. Okay, so Dr. Hinsa, this is a very good try. It's very good try. I can give you C plus, and you are close to B. Just you need to improve a little bit more to get B grade. Okay. So, Dr. Digia. Okay, sorry, if I mispronounce your name. Dr. Digia, are you there? So here we need one blank line before date, one blank line after date, and then I'm writing to update you regarding Miss Walter, who was admitted in note 2, admitted to our hospital. No need to mention our hospital. This is your hospital. That is okay, but no need to mention in the letter. It is my hospital or my. Okay, please no need to mention. For second degree burns with PTSD following domestic violence. Therefore, your continuous assessment would be highly appreciated. Okay. Okay, doctor. So therefore, your continuous assessment. Actually, this is not continuous assessment. This is follow-up care. That would be better to use follow-up care. And your word count is okay. 216, that is okay. On this state, Miss Walter was admitted following acid attack. Acid attack poured by. This is not good, doctor. This is not good. Following an acid attack by her husband. Following her husband poured acid on her face, something like that. This is not good. She was brought to hospital when neighbors heard her daughter screaming. Okay, on admission, she had severe pain, redness, burning at face, burning sensation, neck and blisters on the right side of her face. On examination, her BP was this: 1 to 2 centimeter blisters were noticed on the face. Booster dose of tetanus and antibiotic were given. As management is not given, not written, not needed. As management, no. Silvazine dressing in burn side, no. On burn side, at burn side was done. And this is not a silvazine dressing was done is enough. No need to mention at burn side. Okay. just remove it. And morphine for pain was also given. Okay. During Miss hospital stay, despite showing a good improvement in symptoms due to scaring of her face, she was depressed. Uh, due, Despite showing good improvement in symptoms. No, this is, you have tried to make it complex sentence, but this is not good. Just make it easy. Her condition was improved, but she still had scaring on her face. She was depressed due to scaring on her face, something like that. Therefore, she was referred to psychologist for counseling and emotional support. Furthermore, we don't use OET in OET furthermore and moreover. She was also referred to plastic surgery. Then mentioned about the surgery was planned on this date here in the same. Okay, today's assessment was showed improvement and was agreed to discharge. This is wrong here. The tense is wrong. Was agreed to and is being discharged, something like that. Please note, Miss Walters' plastic surgery has been planned on this date. This is a little bit slow. This is how I mark the letters during my class for my students, but this is a little bit slow because today we have wasted time due to my patient. She requires continuous monitoring of social thoughts at least twice a week and also require compliance to, okay. Please, this is the discharge plan. You can write this same as the discharge plan. We don't need to write. I'm writing for further management of, this is not needed. This sentence is not needed. Just make it, this one should be your conclusion. Okay, conclusion. Okay, Dr. Digia, your letter is good, but I will give you borderline B, close to C plus, means close to B, not clear B, but I will say close to B. Okay. Okay, close to B, not clear B. Just improve grammatical mistakes, and these things are not needed here. Paragraphing can be improved a little bit more. So purpose can be improved a little bit more, Dr. Digia. Then we have anybody else whose letter is on my screen? Dr. Nadeem, this is your letter. I have already marked. Okay. Dr. Nadeem. So the only problem with your letter was, the main problem was it was long, 238 words. It should be less than 220, between 180 to 220, and there were just small mistakes. And try to be more concise, Dr. Nadeem, please. I have already marked. So who else is there? Royal Ayub, okay. Dr. Laila is there, okay. I will mark yours also. Okay, so is a nurse, Royal Ayub is a nurse. So first we will count your words. Your words are okay. 185, very good. I'm writing this letter to introduce. No need of this letter, just I'm writing to introduce. Even introduce is not needed because you are writing back to GP. I'm writing to update you on would look better, okay. I'm writing to update you on. Okay, I can maximum mark 10 letters in the class. So I'm sorry, I cannot mark any more letters. If you have sent me on WhatsApp, I cannot mark any more because I can mark only limited number of letters. Okay, so this is not needed. Miss Walter, into your care, who has been admitted since 2 weeks. This is not needed. Since we don't use since with 2 weeks, and even it is not needed here. Who has been treated for second degree burns and post-traumatic stress disorder due to domestic violence. She requires your ongoing support and care after being discharged with ED today. Initially, Miss Walter was presented with, was presented is wrong because passive voice here is not needed. We are not mentioning was presented by his mother, by a father, by a daughter. So passive voice is wrong here. This is not a single, these are more than one complaint. So with complaints of this, and however, she was given treatment by removing acid from clothes and skin with the help of water and application of silvazine dressing. Silvazine should be capital. On the other hand, painkillers, antibiotics, and vaccine had been administered. We don't need very strong sentence here. Were administered would look better. Miss Walter responded well to the treatment after a few days. Very simple sentence. Very simple sentence. You people can see. Very simple sentence here. Again, very simple. She has been going through depression is not good sentence. Hence, she has been taking. Actually, you people can see this is initial visit, and then he is writing about responding well, then depression, then past medical history, here. Then furthermore, she was referred to clinical psychologist. So this is not good organization. This is not good organization. We need to organize. We should need to write first visit, next visit, next visit. Okay. Then social history, past medical history, then conclusion like this. Okay. Is referred is wrong because she was referred in the past. Okay. This is wrong tense here. She need counseling and emotional support. So this is also not very simple sentence. Recently, she has multiple scars. Scars should be mentioned here, not here. Recently, she has multiple scars. The tense is also not good. Also monitor her. So conclusion is also not good. So Mr. Royal Ayub, what I will suggest you please compare with the model answer. I will share model answer in WhatsApp groups. Please compare with model answer and try to improve, please. This is C grade. This letter is C grade. Okay. So please try to improve. Try to improve, please. Okay, the last letter that I will mark is Dr. Laila. Dr. Laila, this is your last, this is the last letter that I will mark, okay. Sorry, I cannot take no questions. Time is too short. Dr. Laila, okay, let us see. The word count is 254 words. 254 words. Here you can see. So what should be the score? 254 words. 254 words. What should be the score? Without reading the letter. Without reading the letter, what should be the score? Without reading, this 254 is too much, too long. So it would be C or C plus, okay? So I'm writing to update you regarding Miss Walter, a patient of you. Patient of you is not needed. Patient of you who has been diagnosed with secondary burns and post-traumatic stress disorder due to domestic violence. Dr. Laila, you have not mentioned what we want from the reader, okay? You have not mentioned what we want from the reader here in the purpose. Miss Walter is married for 3. After purpose, you should write the most important visit, this visit, okay? The incident, instead of writing social history here. Is married for 30 years, has been married. Is married, no, has been married for 35 years. This is wrong here. Lives with, living, no, lives with, okay, if you search here, strong family depression and smoke, a smoker for, and has been smoking. So here we need a lot. Dr. Laila, this is your first letter. Dr. Laila, this is your first letter. On this date, we need comma here. The name of the patient instead of she was brought by police in an ambulance to the emergency department of hospital. No need of hospital. with severe ER, severe pain, redness, and blister on her right face. Her husband spilled a bottle of acid on her face when she was sleeping in her room. Her husband was arrested. Yeah, okay. So, okay, no problem. I can understand from your letter that this is first attempt. On examination, everything was normal. Oh, this is not good in formal way. Everything was normal, not good, not good. Except that she had mild shortness of breath and white and black blister on 2 centimeter were noted on her face. Acid was removed with her clothes, from her clothes and face. With water, silvazine should be capital was applied. Silvazine should be morphine was given to relieve pain. Antibiotics is singular, is plural, and was is singular, is not good. Given and a booster dose of tetanus vaccine was injected. Okay, doctor, we need a lot of improvement, Dr. Lala. 1 week later, she came back with good recovery, but coma should be before, but she still had mild pain and a tingling sensation on her face. She was depressed due to multiple scars of 1 to 2 centimeters on her face and was referred spelling instead REFE double RED to hospital general physician to hospital general physician no to hospital clinical psychologist for counseling and emotional support. In the state, we should use name of the patient at the start of new sentence. Okay. So overall, Dr. Lala, we need a lot of improvement. I will give you C grade, Dr. Lala, but don't worry, Dr. Lala. This is not a problem. You will improve. You're just starting and you will improve a lot with time. So what you can do is just watch my YouTube videos regarding writing. Okay, just search DrChe plus name of your exam and you can watch some videos there. So slowly and gradually you will improve. Okay. So any question, anybody, any question? Any question for me? Okay, thank you so much. So if you have any question, please let me know in the on my WhatsApp. And what we should do tomorrow? What we should do tomorrow? Reading, writing, speaking. What we should do tomorrow? Reading, writing, speaking. What we should do? I want to go through my mistakes. I don't know what you want to say, Royal. Just send me a message. This is your letter. This is your letter. I can send you a screenshot. Okay. Yeah, this is your letter. Royal Ayub. This is your letter. Okay. Okay, writing, listening, reading. Okay. We will try reading if possible. Okay. Part B if possible. Thank you so much, all of you. So, what are the linking words we can use in OET? This is a long topic, long, but don't use furthermore, moreover. These are not good. Others you can use in addition, initially, but therefore, however, these we can use. My model answer will be shared in WhatsApp groups, hopefully. Okay, thank you so much, all of you. Thank you. Please try to share with your friends. Try to invite your friends, okay, for the class. Thank you so much.